You know, it's no secret there are a lot of rules about what you can and cannot consume when you're breastfeeding. It all comes down to your baby ingesting what you consume through the breast milk, and that includes medications. In this morning's STL Moms Report, Fox 2's Molly Rose is learning about what medicines are okay to take while breastfeeding and which ones are off limits.
Hey there, Randy. We are talking with Molly Veltz this morning. She's a lactation consultant at Missouri Baptist Medical Center, and she says that many nursing moms don't realize how many medications are compatible with breastfeeding. And Molly, thanks for being with us this morning.
Thank you for having me.
This is a really important topic, and I want to get right to it. What do nursing moms really need to know about over-the-counter medications?
Well, first of all, they need to know that medications do pass into their breast milk when they're lactating. So you want to exercise some caution and make some thoughtful decisions, but there are many over-the-counter medications that are safe for mothers to take. And that's because a lot of the medications pass into breast milk in small amounts. So the baby is exposed to a fraction of the dose that the mom is taking. So if you're in Walgreens or CVS, you have a cold, the flu, seasonal allergies, there are a lot of options available that you can safely take.
What are some of the things that would be safe to grab, and then a couple of things that you would say are just always no's?
Okay. You can treat your symptoms. You want to avoid a decongestant. So that's one warning I have if you do have a cold and you're shopping in the drugstore for a medication. The decongestants are safe for your baby, but they can affect your milk supply.
So good to know.
So a lot of moms have worked hard to establish their milk supply, and they don't want to take a decongestant that's going to compromise that. So you want to steer clear of those multi-symptom cold remedies because they frequently contain a decongestant. But you can shop for, Tylenol or an antihistamine, and in some cases, cough suppressant as well.
What would be those things that you say you just got to stay away from it altogether?
Entirely when you're a breastfeeding mom. So there are some drugs that are, and some conditions that are really difficult to treat when you're breastfeeding. The anti-cancer drugs are almost always a no. Illegal drugs you want to stay away from. Some of the drugs that have a high potential for abuse, such as opioids or Adderall, you can sometimes safely take those drugs, but you really need to exercise caution, maybe work with your pediatrician so your baby can be monitored while you're taking those drugs, and take them exactly as prescribed.
Okay. And sometimes women get in this really frustrating situation where a doctor, someone gives them medicine and says you need to pump and dump. So you can't actually give the milk to the baby, but you still have to pump to get the supply of milk. Right. Why is that so frustrating when it's just not needed sometimes?
So, you can have a prescribing physician who is not knowledgeable about how medications pass into breast milk. And so in order to err on the side of caution, they may recommend that you wean baby first or pump and dump. If that happens to you, you may want to get a second opinion from a lactation consultant. We use this drug guide here. It's Medications in Mother's Milk. And we can give nursing moms very specific information about the drug that they need to take. Now, we would not advise them to disregard the instructions from their physician, but we would give them the lactation risk category of the drug that they're planning to take. And we would arm them with information and specifics and then have them return to their prescribing physician and have another conversation about taking that drug and hopefully not discontinuing or interrupting breastfeeding because babies don't like that.
Yeah.
And it's a lot of work for mom, and it's sad when you pump that milk out to pour it down the drain.
Right.
It's heartbreaking.
Well, we've got to wrap up, Molly, but I want to thank you so much for all the information, so helpful for so many nursing moms out there. Let's send things back over to Randy and John now.